Hey everyone, ready to become expert eavesdroppers.
Oh, I like that.
Today's deep dive takes us into the world of auscultation, the art of listening to your body's internal symphony,
Okay.
specifically the one playing in your lungs.
It's more common than you might think.
Yeah.
Even if you aren't a medical professional,
Mm-hmm.
understanding the basics can really help you understand your own health better
Right,
and communicate more effectively with your doctor.
exactly. And that's what I love about these deep dives.
Yeah.
You know, we take a seemingly complex topic
Mm-hmm.
and break it down into something everyone can use.
Right.
So no superpowers needed for auscultation.
No superpowers.
Just a simple tool.
You got it.
Okay.
The stethoscope,
Ah,
a doctor's trusty sidekick for over 200 years.
wow.
It lets us hear the subtle music of your lungs, giving us clues about how well they're working.
I remember as a kid,
Yeah.
I thought the stethoscope was like magic,
Mm-hmm.
but it's actually pretty straightforward,
It is.
isn't it?
Auscultation is quick,
Mm-hmm.
inexpensive, and risk-free.
Wow.
Yet it can reveal a surprising amount about your respiratory health.
Okay.
Think of it as translating the language of your lungs.
I love that. Okay, so I'm hooked.
Great.
But before we get into the different sounds,
Yes.
can we do a quick anatomy refresher?
Absolutely.
I need to brush up on my lung geography.
It's like knowing where to point your antenna to get the best signal.
Okay.
So picture this. You have two lungs,
Mm-hmm.
and the right one has 3 lobes.
Okay.
Think upper, middle, and lower.
Okay.
Now the left lung only has 2,
Oh.
upper and lower.
Interesting.
It's like it got shortchanged in the lobe department.
Uh-huh. I love that.
Uh-huh.
So where exactly are these lobes hanging out?
They take up a good chunk of your chest
Mm-hmm.
from above your collarbones
Okay.
down to the diaphragm.
Got it.
We listen from both the front and back of your chest
Okay,
to
sure.
get a complete picture, as each location gives us access to different parts of the lungs.
That makes sense.
Yeah.
So, got my mental map,
Okay.
got my stethoscope.
Got it.
Now, how do I actually perform this auscultation magic?
First, find a quiet spot.
Okay?
You're trying to hear a whisper, not a shout.
Yeah.
Then have your subject sit up straight,
Okay.
relaxed,
Mm-hmm.
and breathing deeper than usual through their mouth.
Oh, okay.
This helps amplify those subtle breath sounds.
Deeper breaths.
Yes.
Mouth open. Got
That's
it.
it.
Anything else I should be aware of?
You'd be surprised how clothing can affect the sounds we hear.
Really?
Even chest hair can create extraneous noise.
Mm.
It's best to have the chest area exposed
Okay.
as much as possible for a clear signal.
Wow, I never would have thought of that.
Uh-huh.
It's amazing how many factors come into play.
It is.
Okay, so we've got our quiet spot,
Right.
repped our subject,
Mhm.
and have our stethoscope ready.
Right?
What are we actually listening for?
That's a great question.
What's the sound of healthy lungs?
In a healthy lung,
Yeah.
you'll hear a symphony of different sounds.
Ooh. Okay.
Let's start with the loudest and highest pitched sound,
Okay.
called tracheal breathing,
Tracheal breathing.
which is heard best over your trachea or windpipe.
Okay.
It sounds like air whooshing through a hollow tube.
Hmm.
If you hear this sound in the lower parts of the lungs,
Yeah.
it could be a sign of pneumonia, which would warrant further investigation.
So tracheal breathing
Yeah.
is all about location.
It is.
Okay, what else are we listening for?
Next, we have bronchovesicular sounds.
Okay,
They're heard best around the upper sternum and between your shoulder blades.
got it.
They are softer and more balanced than tracheal sounds,
Mm-hmm.
with inspiration and expiration sounding roughly equal.
Got it. So it's like a middle ground sound.
Yes.
Okay, what about the quietest sounds?
Those are vesicular breath sounds,
Yeah.
and they're heard over the peripheral lung fields,
Mhm.
where the tiny air sacs are. Imagine a gentle breeze rustling through leaves.
Okay.
That's the sound of healthy air sacs at work.
I love that.
Inspiration is longer than expiration with these sounds.
Okay, so we've got our loud tracheal sound,
Yes,
the balanced bronchovesicular sound,
that's right.
and the gentle breezy vesicular sound.
Uh-huh.
These are the hallmarks of healthy lungs.
Exactly.
They are the foundation of our lung symphony.
They are.
But sometimes this symphony can get a little off key.
Yes, it can.
That's where adventitious sounds come in.
That's right.
Ooh, adventitious sounds.
They can be.
They sound a bit ominous.
They are sounds that shouldn't be there,
Okay.
and they often indicate an underlying problem.
All right. I think we've laid a great foundation here with normal breath sounds.
We have.
In part 2, we'll explore these adventitious sounds and learn what kind of red flags they might be waving.
Sounds good.
See you then.
Yeah.
Welcome back to our Auscultation Deep Dive.
Ready to explore those off-key notes we call adventitious sounds.
Absolutely. They sound like they could hold some important clues about what's happening in the lungs.
That's right. Adventitious sounds can be like warning signals, alerting us to potential problems that need attention.
So let's jump right in.
Okay.
What's the first unusual sound on our list?
We'll start with a sound that's not necessarily abnormal by itself,
Okay.
but becomes a concern when heard in the wrong place.
Okay.
Bronchial breath sounds.
Wait, didn't we already cover those?
You did.
The loud tubular sounds over the trachea.
You're right. But remember how we talked about location being key?
Yes.
Hearing bronchial sounds over the peripheral lung fields, where we normally expect those soft vesicular sounds, is a red flag.
So it's like hearing a foghorn in a library.
Exactly.
So definitely out of place.
Bronchial sounds in the periphery often point to consolidation.
Okay.
Where the air sacs are filled with fluid or solid material, making the lung tissue denser.
Ah, so it's like trying to hear someone whisper through a concrete wall?
Yeah, a great analogy.
The sound just doesn't travel the same way.
This is often the case with pneumonia, where the air-filled spaces are replaced with inflammatory gunk. Hearing this sound should prompt further investigation.
Okay, that makes a lot of sense.
Good.
So location is everything when it comes to bronchial sounds.
Yes.
What's next on our list of suspicious sounds?
Let's talk about diminished breath sounds.
Okay.
Imagine you're trying to listen to a radio station with a weak signal.
Okay.
The music is there.
Yeah.
But it's faint and obscured by static.
Sounds subtle but concerning.
It can be due. Diminished breath sounds are quieter than expected, and they can signal a range of issues.
Okay.
From conditions that obstruct airflow, like COPD or asthma, to those that create a barrier between the lungs and the stethoscope.
Oh, okay.
Like pleural effusions or even obesity.
So anything that muffles the sound waves can lead to diminished breath sounds.
Precisely. It's like trying to hear a conversation through a closed door. The message is getting through, but it's distorted and difficult to make out.
All right, moving on to a sound I'm sure we've all heard before.
Okay.
Wheezes.
Yes.
Those high-pitched whistling sounds are pretty hard to miss.
Wheezes are like the squeaky door hinges of the respiratory system.
Okay.
They tell us that something is narrowing the airways.
So what causes that squeaking or wheezing sound?
It could be bronchospasm.
Okay.
Where the muscles around the airways tighten, or inflammation, which makes the airways swell. Sometimes it's even a foreign object lodged in the airway.
And I remember you mentioned different types of wheezes.
Yes.
Monophonic and polyphonic. What's the difference again?
Imagine a single flute playing a high note. That's a monophonic wheeze.
Okay.
Caused by a single narrowed airway.
Got it.
Now imagine a whole orchestra of flutes playing different high notes.
Okay.
That's a polyphonic wheeze.
Okay.
Indicating multiple narrowed airways.
So the more flutes we hear, the more widespread the problem is likely to be.
Exactly.
Yeah.
It helps us understand the extent of the airway narrowing.
And what about those other wheezy sounds?
Yes.
Raunchy and stridor.
Think of rhonchi as the low-pitched snoring cousins of wheezes.
Okay.
They're often caused by thick secretions rattling around in the airways.
Oh, okay.
And tend to clear up with a good cough.
So those are the ones that sound like someone trying to clear their throat.
You got it.
Okay.
And then we have stridor.
Yeah.
Which is a high-pitched wheeze heard primarily on inspiration.
Yeah.
It's like a warning siren.
Okay.
Indicating a blockage in the upper airway.
Got it.
Like in croup. Or after someone has been extubated.
Yikes. Definitely a sound that would make me pay attention.
Absolutely. Stridor requires immediate attention, as it can significantly restrict airflow to the lungs.
Moving on to another sound that paints a vivid picture.
Okay.
Crackles.
Yes.
It's like hearing Rice Krispies in your lungs.
That's a great way to put it. Crackles are those discontinuous popping or bubbling sounds, often associated with fluid in the airways.
Right.
And just like with Rice Krispies, there are different sizes.
Oh, interesting. So what do the different sizes of crackles tell us?
Think of it like this.
Okay.
Fine crackles, the tiniest ones, are like the subtle fizz of champagne.
Okay.
Often indicating early stages of pulmonary edema, where fluid leaks into the air sacs.
So they're like a gentle warning sign that things might be starting to go wrong.
Precisely.
Okay.
Medium crackles are a bit louder, like the pop of a soda can opening, suggesting more significant fluid buildup.
And what about the biggest, loudest crackles?
Those are the coarse crackles.
Okay.
Like the snap, crackle, and pop of Rice Krispies in milk.
All right.
They indicate a more severe case of pulmonary edema or excessive secretions in the airways.
Wow, it's amazing how much information we can get from these subtle differences in sound.
It is.
It's like deciphering a secret code hidden within the breath sounds.
Uh-huh.
Speaking of intriguing sounds,
Yes.
we can't forget about pleural friction rub.
Right.
That one sounds particularly ominous.
Pleural friction rub is a very distinct sound.
Okay.
A creaking or grating,
Mm-hmm.
like two pieces of sandpaper rubbing together.
Ouch. That doesn't sound pleasant.
It can be quite painful, especially with deep breaths.
Yeah.
It happens when the pleural surfaces, those delicate membranes surrounding the lungs,
Right.
become inflamed and rub against each other.
Okay.
Like in pleurisy or pneumonia.
So it's like a sign that the lungs are irritated and sending out a distress signal.
Exactly. And just like with other adventitious sounds, it's a clue that warrants further investigation.
We've covered a lot of ground here with these adventitious breath sounds.
We have.
It's incredible how much they can reveal about what's happening in the lungs.
It is?
But what happens when a doctor hears one of these abnormal sounds?
Yeah.
Do they immediately jump to conclusions?
Not at all. Auscultation is just one piece of the puzzle.
Okay.
It's always combined with other clinical findings,
Mm-hmm.
like the patient's history, symptoms,
Okay.
and other physical exam maneuvers,
Okay.
to form a complete picture.
So it's like a detective gathering clues to solve a case.
Precisely.
Yeah.
And sometimes we need to call in reinforcements,
Right.
like imaging studies or lab tests,
Okay.
to confirm our suspicions and guide treatment decisions.
That makes sense. Before we move on to those other diagnostic tools,
Yeah.
there's one more type of lung sound we need to discuss.
Okay.
Voice sounds.
Okay.
What are those all about?
Voice sounds are another fascinating aspect of auscultation,
Okay.
offering even more clues about the state of the lungs.
All right.
We listen to the patient's voice as it travels through the respiratory system,
Mhm.
analyzing how the sounds change over different areas.
So instead of just listening to breathing, we're listening to talking.
Exactly.
Yeah.
By paying attention to how the voice sounds are transmitted and altered, we can glean valuable information about the underlying lung tissue.
Intriguing. What kind of voice sound clues are we talking about?
There are three main types:
Okay.
bronchophony,
Mm-hmm.
whispered pectoriloquy,
Okay.
and egophony.
Got it.
Each involves a different way of listening to the patient's voice and reveals different aspects of lung function.
Ooh, another sonic trio. I'm ready to dive in.
Let's do it.
Let's start with bronchophony.
Okay.
What's that all about?
In bronchophony, we're assessing the intensity and clarity of the spoken voice.
Okay.
We ask the patient to say words like 99
Right.
while we listen over different areas of their chest.
And what are we listening for? What's considered normal and what might be a red flag?
Over normal lung tissue.
Yeah.
The spoken words will sound muffled and indistinct,
Okay.
like someone's talking from behind a door.
Got it.
But over areas of consolidation where the lung tissue is denser,
Hmm.
the words become much clearer and louder, almost as if the person is speaking directly into the stethoscope.
So it's like the consolidation acts as an amplifier for the voice?
Precisely. The denser lung tissue allows the sound waves to travel more efficiently,
Right.
making the voice sound louder and clearer. This can be another indicator of conditions like pneumonia.
Fascinating. Now, what about whispered pectoriloquy? That name sounds even more intriguing.
Whispered pectoriloquy focuses on the transmission of whispered sounds.
Okay.
We ask the patient to whisper something like 1, 2, 3
Okay.
while we listen to their chest.
I'm guessing things get interesting over those areas of consolidation.
You bet. Over normal lung tissue, the whispered words will be very faint and barely audible.
Right.
But over consolidated areas,
Yeah.
those whispers become surprisingly clear and distinct,
Wow,
as if the person is whispering right into the stethoscope.
wow, that's almost spooky. It's like the consolidation gives those whispers a megaphone.
It's quite remarkable how much the density of the lung tissue can affect sound transmission. And finally, we have egophony,
Okay.
which adds another layer to our sonic investigation.
All right, lay it on me.
Okay.
What's egophony all about?
Egophony is all about how vowel sounds change over consolidated lung tissue.
Got it.
We ask the patient to say a long E sound,
Right.
and over normal lung tissue, it
Yeah.
will sound like, well, a normal E.
Makes sense.
Yeah.
So what happens when we listen over consolidated areas?
This is where things get interesting. Over consolidated lung tissue,
Yeah.
that E sound transforms into a nasal A sound.
Oh, wow.
Almost like a bleeding goat.
Wait, a goat. So if we hear a goat bleeding in someone's chest, that's a sign of consolidation.
You got it. It's a classic sign known as egophony.
Okay.
Derived from the Greek word for goat voice. And it's another valuable clue that can help pinpoint areas of the lung affected by consolidation.
These voice sounds are amazing. I never realized how much information we could get from simply listening to someone talk.
It's a testament to the power of auscultation and the subtle ways our bodies reveal their secrets through sound.
Right.
But remember, auscultation is just the beginning.
Right. It's like the opening act of a much larger performance.
Exactly.
In part 3, we'll explore how technology is taking auscultation to a whole new level.
That's right.
Giving us even more tools to diagnose and treat respiratory conditions. See you there.
Sounds good.
Welcome back to our final deep dive into the world of auscultation.
We've covered a lot of ground.
We have.
From the symphony of normal breath sounds.
Right.
To those telltale adventitious sounds.
Right.
And even the fascinating nuances of voice sounds.
It's been like learning a whole new language.
It has.
The language of the lungs.
Uh-huh.
But our exploration wouldn't be complete without talking about how technology is revolutionizing the way we listen.
Absolutely. We've come a long way from those simple wooden stethoscopes. Today, we have an arsenal of high-tech tools that amplify our ability to hear, analyze, and interpret lung sounds.
So it's like giving doctors superhuman hearing.
In a way, yes.
Okay.
One of the most exciting advancements is the digital stethoscope.
Oh, cool.
These devices don't just amplify sounds, they filter out background noise and even allow recordings for later review and analysis.
It's like upgrading from a grainy old radio to a high-definition surround sound system.
Digital stethoscopes give us a much clearer and more detailed picture of what's happening inside the chest. And because they can connect to computers and smartphones, we can create visual representations of the sounds.
Wow.
And use sophisticated algorithms to analyze them.
Wow, that's amazing. It's like having a sonic microscope for the lungs.
Another game changer is lung ultrasound.
Lung ultrasound, okay.
Which uses sound waves to create real-time images of the lungs.
Oh, wow.
It's like seeing the lungs in action, not just hearing them.
So it's like having X-ray vision for the lungs, but without the radiation.
You got it. Lung ultrasound can help us detect things like pleural effusions, pneumothoraces, consolidation, and even subtle changes in lung tissue texture.
It sounds like technology is really enhancing the power of auscultation.
Absolutely.
Giving us more information.
Yes.
And potentially leading to earlier diagnoses.
That's the goal.
That makes sense.
These tools aren't meant to replace the traditional stethoscope, but rather to complement it. Think of it as a team effort.
Like having a whole squad of sonic detectives working together.
Precisely.
To solve the mystery of the lungs.
And this collaborative approach is already leading to more accurate diagnoses, better treatment decisions, and ultimately improved outcomes for patients.
That's fantastic. This deep dive into the world of lung sounds has been truly eye-opening.
It has.
We've learned so much about the symphony of sounds within our chests.
This is fascinating.
And the incredible tools that help us hear them with greater clarity and precision than ever before.
And we're only going to continue to get better and better tools.
That's really exciting. So next time you're at the doctor's office and they pull out their stethoscope, remember what we've discussed. You might be surprised at how much you can understand just by listening.
And remember, even if you aren't a medical professional, having a basic understanding of auscultation can empower you to be a more informed advocate for your own health.
Absolutely. Well, thanks for joining us on this deep dive.
My pleasure.
Into the fascinating world of lung sounds.
Until next time.
Keep listening to your body and stay curious.